Hello, everyone, and welcome to another episode of Innova Chat. I'm very excited today to introduce you and talk to Keely Kent. Keely Kent and we go way back. Keely is VP of Compliance and Clinical Services for Continuum Therapy Partners, and she also serves on the board of NARA, which is the National Association of Rehab Agencies. So, given her expertise and given her knowledge in the industry and all her years of knowledge in the industry, primarily in, I would say, long-term care, skilled nursing,
Yeah,
assisted living, and so forth, we're going to focus today's conversation a lot on compliance. Where is compliance going? Um, how are we positioning as an industry to be able to sustain audits from payers, for example, is going to be something that's going to come up. And we're going to talk also about advocacy because, Keely is very, very involved with advocacy, especially with NARA serving on that board. So, Keely, welcome. Welcome to Innova Chats.
happy to be
And
here. This is exciting.
yeah, and I did forget to tell that everybody that Keely is also a PT by background, right?
Yes.
So let's start there.
Oh,
How did a physical therapist end up as VP of Compliance and Clinical Services um, for a couple of large organizations now? I would say you
sure.
guys have many, hundreds of contracts now. How did your journey, take you to compliance, and why did you get interested in that?
It's interesting when I look back on my journey because I started at a building and I was the PT, supposed to have another PT, side by side with me as a new grad. And that person was a manager and he was looking to get a promotion. So he was out of the facility a lot trying to run other buildings. And so that first job as a PT actually had me doing a lot more operation stuff than I thought that I would do. And when I was in my clinicals, I actually did a clinical with someone who was also a manager. So like I already had like a little bit of interest in a bigger picture of therapy because I got to see a little bit more behind the scenes when you're working with a manager. So that first job, I was like, oh, I got a little taste of it. And then the second job, I got a little taste because I was in a transitional care unit. We would bop over to acute care. We would do home health, kind of go all over the place. And I got to be team lead and kind of run my hallway. And I was like, oh, this is fun, a little bit different than being a PT, right? I'm still going to treat patients. But then I had an opportunity to take a managerial job. And from that managerial job, whenever you do well as a manager, sometimes they give you lots of extra work to do, right?
That's the curse.
Yes, you do a great job, and so they give you extra things to do. And so I ended up taking an operations role, and at one point oversaw about 350 contracts in operations with my boss at the time and another person. So we were really busy in operations, but a lot of the things that would kind of come to my plate in operations were just documentation issues that we'd see at the facility or audit issues, or maybe I would have a facility that would call me and be like, I just don't know what to do with this patient. And I was like, well, I have a great clinical program for you. So it really sparked my desire to help that facility because I'm used to helping patients, right? We go to school to be PTs because we want to fix things. We like to build things. We like to do all kinds of stuff with our hands. So whenever you're in a larger operations role, I was like, well, now I have the opportunity not to treat 10 patients a day, but to treat 110 patients a day because I had different facilities, right? So my passion would be like, let's talk about this clinical program or let's see, what we can do better because we're seeing a couple of denials for this patient. I always tell the story about my favorite patient who came to the facility and they were going to kick him out of the facility even though he was bedbound. And I fought the insurance company every single day. So he was an incomplete spinal cord injury. And I fought for him and I fought for him and I fought for him. And he ended up being able to stay because I fought for what was right and my documentation was really great. And he ended up going home alone and ambulating. And so that was like the turning point in my life that I was like, I
Oh,
can make a difference by arguing whenever I have great skilled care, right? So it just sparked that in me. Whenever our company decided to be formed, they kind of talked about what my passion was, and I loved regulatory stuff. I loved looking into audits. I liked being able to help the whole big picture instead of just a couple patients a day. I could help thousands of patients a day. clinically and from a regulatory and compliance standpoint, you use your PT brain to fix things just in a little different manner.
That's awesome. That's such a cool story, right? That just through being able to manage your clinical documentation well, right?
Hmm.
And make it compliant, you were able to truly advocate for that patient, right? So it
Yes.
tells you a little bit about a lot, not a little, a lot about the importance of good clinical documentation, sound clinical
Yes.
documentation to be able to help your patients, right? As much as we
Mhm.
all hate to do clinical documentation, it's so
Correct.
critical.
It's awful.
Yeah,
Yes. But we
yeah,
have
yeah.
to do it, right?
Yeah, we
If you
have to
don't
do it. Yeah,
document it, it didn't
yeah,
happen. It's
that's right. That's right. That
the
is great.
curse that we have.
Yeah. Now, let me ask you this question, because there are some organizations that are really, really heavy in compliance, in clinical services and
Hmm.
compliance, right? I'm talking about rehab companies in general, right?
Sure. Yeah.
Really, whether it's, outpatient clinics or, in the skilled nursing, assisted living, senior living world, right? The difference between operations and compliance, I see some organizations that are more ops focused, right?
Sure.
Others are, more like compliance clinical services focused, right? I think they're
Mhm.
both important, but how does how do you determine whether, compliance should be part of ops? Should it be separate, right? Should it be completely two separate departments, right? What is your
Yeah.
philosophy behind that?
So I definitely think compliance needs to be a third party, right? It needs to be kind of like that third entity. But as a person who used to be in operations, I also understand that you have to maintain a culture. You have to maintain operations because without operations, you don't have compliance. You don't have the need for compliance. But everything also starts clinically because if you're doing the right thing clinically, everything else follows. So there is that balance of like, you want a culture of compliance, right? You want people to do the right thing. If they see something, say something. You want to have a proactive compliance because you want people to come to you, right? You want to find things before those things kind of bite you. But you also have to think operationally. If you're hounding someone daily with an audit, are you going to want to work there, right? There's a way that you can approach that. There's a way which you can kind of help guide them towards where you're trying to go without feeling like it's punitive because no one wants a punitive compliance program because then you don't feel like you can go to compliance. So my philosophy has always been I have an open door. I want people to feel like compliance is way separate from operations because sometimes they have to tell me some hard things about operations, right? They have to come to me and say, this happened and I didn't, and I don't feel like it was right. And I have to be very unbiased to say, I will do an investigation, I'll look into it. But also, there, like I said, with that culture, we have a philosophy in Continuum where we have a group that meets together and we kind of run things by them. They're our employees. And we'll go through the pros and the cons and we'll say the yeah buts about it. Yeah, if we do this, what's the consequences? Because we also remember that we hired very highly intelligent people who are very well paid. And there are things that sometimes we have to be like, the expectation is that you follow the rules, but we want kind of those guardrails in between it.
Great. So let's get a little bit more tactical, right? How do you,
Mhm.
because I love what you said about building that compliance culture without being too punitive, right? So
Sure.
can you get a little bit more granular as to like what are some of the things that you do to build that culture of compliance within your department and your organization?
Yeah, absolutely. We do monthly check-in calls where everyone gets to participate and we can tell them what we're working on in compliance, very open book. Like these are the things that we're looking at. These are why we're looking at it. This is why we're doing that. We like to provide everybody with the why because when you understand the why, I think you're just more apt to go with the flow. Um, I like to just call and check in on my DORs, make sure the RVPs always feel like that they can call me. Um, we do when it's compliance week, we like to do kind of fun things about like just different rules and regs. Again, it's more to me like about being an open book. There's nothing hiding in compliance. Everything I'm looking at, you have access to look at. Your documentation, I'm looking at the same documentation, right? We're not trying to look for anything hidden. We're just trying to look for things that can help you be better. We want that quality assurance piece from compliance to be high on everyone's mind. But I don't think there's any like true secrets. It's just about being when someone calls me or calls my team. My team is fantastic. Nicole and Carrie, I know they're going to watch this. They're so great. I'm lucky that I have them. when they call them, I also want them to feel like they're embracing that phone call. They're happy about that phone call. They're eager to help. Like compliance and customer service to me go hand in hand. We have to be empathetic to what they're going through, but we also need to help their days be easier. We are their support team, right? We're there to support them, make their days easier.
Give me an example of a tough call that you get, right? From, let's say, because if you do have an open policy, right? An open door
Yeah.
policy, right? I'm sure that you get, without, getting, too
Hmm.
deep there, but like just an example of that. You've managed, by now, I mean, hundreds, of locations, right? So you've seen it all, right? Like, what
Yeah.
are some of these things are like open door policy things that you're seeing that like because of that things have come out, right? It's like you drive that culture of, hey, you guys can come and talk to us, but you're gonna start seeing some stuff that that you need to fix, right? So like, what are some of the things that I don't know if you have any
Well,
particular
yeah, I
anecdotes
think you're
or
always going to get those people that are like, hey, I don't know if so and so was here as long as they said they were here, or, you know, there's some treatments that I think that need to be looked at because I don't think that they're as great as they could be. But in my former life as an operator, I got different calls. Like one time a person called me, they're like, someone smashed a banana all over my desk. And I was like, what? Right? Like, you're just, it's
were they
the
treating like a
wildest.
2-year-old and they were smashing
Yes,
the banana or
they were
something?
mad. They were mad and they smashed a banana. And like I've had some of the wildest calls, especially when I was in operations, of things
I
you're
can
like,
imagine. Mhm. Yeah,
but we work with people, right? So
that's
people
right.
get angry, people get
Yeah,
upset.
yeah,
But from a compliance standpoint, sometimes it's just as easy as like I got a call today about a diagnosis code,
right,
right?
right.
So just someone reaching out, they're like, here's the diagnoses, what's the best code to use? Now we
Yeah,
shouldn't be using these dementia codes. So like sometimes it's just pretty simple.
yeah,
Sometimes it's, hey, I have a regulatory question about my state. What can this PTA do versus my codas? So everything's is a little bit different.
yeah.
I think that's why I really like compliance because I never know what I'm going to get that day, right? There's nothing straightforward about my day. Every day is something new and exciting and a different question that you probably couldn't have prepared for.
What are the things that you're measuring, right? From as a compliance officer, right, in your organization, what metrics are you looking at,
Mhm.
right? Is it more geared towards like auditing clinical documentation, right, or making sure that the EHR has the right LCDs or whatever it may be?
Sure.
What is it that you're measuring on a regular basis to make sure that you're going to say your organization is staying in compliance with uh, regulatory matters and changes and so forth?
Yeah, we try to be pretty flexible because things change so frequently. So, most months we do the same kind of audits, like technical audits, to make sure that we have everything technically, like our documentation signed, physician signatures, that kind of stuff. We're looking at medical necessity. We're looking at, goal writing, just different areas of opportunity for like better documentation. But sometimes we're just kind of scanning the system to look at, when are people signing things? Are they in the system when they're supposed to be in the system, right? Do those things line up? Because we want to keep ourselves safe. Are we only using approved devices? That's really important. Are we making sure that, staff are in the building during times that we think they should be in the buildings? So some of those things we're just looking at to kind of keep us safe and make sure that we're giving great customer service to the clients. But other things like this month, there was the unapproved diagnoses codes that rolled out. So we had to go back through and audit and make sure that our primary diagnoses weren't on that code list. So every month we try to be a little bit more flexible. We're part of some great groups that do talk about denials and appeals. And when they start seeing trends, we want to attack those trends as well to make sure that if we're seeing it, we can kind of correct that before it gets too big.
Yeah, that's a huge topic, right? So denials and appeals, and I know that a lot
Oh,
of our listeners are, interested, in that particular topic. It affects the bottom line, and when it does,
yes.
then everybody's interested, right? But what are you seeing out there in terms of denials and appeals right now? What are the most common themes that you're seeing in where, some, in claims denials?
The most common themes, we have some payers that will just deny the first round just to deny them. And then as soon as you fight it, it gets paid, which is frustrating because that's
Mhm.
just administrative burden. We're just seeing we're getting a lot of TPE still. a lot of ADRs. Um, I think everyone's just in the mindset of they need, they're going to claw back money however they can claw back money. So,
Those of you that of us that are on the call that are not, or listeners that are not familiar with TPEs,
Mhm.
can you break down the acronym and ADR?
Yeah, targeted, probe, and educate. So basically, they're going to review your documentation and see if they need to review more. If you don't pass, they're going to review more, but they're, supposed to educate along with that.
And the ADRs?
Additional documentation review. So they want to see, do you have everything that you're supposed to have? They're going to kind of dig into that documentation and make sure everything's there, and then they're going to review it.
Are you seeing that more
Mhm.
lately? And
We
is
are,
that a
yeah.
trend that you're seeing across the industry as well?
Yeah, I think just based off the calls that we're on, it seems to be the industry wide they're rolling out a little bit hot and heavy compared to what they were, and they're going back. Some of the things that our appeal specialist is getting, it could be kind of far back, but we're getting a lot of ADRs or TPEs um, that we didn't think we would get, right? So more than we thought that we would get. And there's even, we were on the DAC call and someone said, I just called them and said they already had theirs. And they were like, oh, whoops, sorry. So my advice to folks out there is it's okay to ask questions because sometimes they make mistakes too. So if you're seeing something that's out of the normal, reach out to your friends in the industry, chat with them and see if they're seeing it too.
Yeah. And just to be clear, I mean, you're seeing these ADRs, TPEs more so across your SNF business, right? The skilled nursing facility
Yes.
business, right? And rehab there. And what payers are you seeing? Is this across Medicare or Medicare Advantage plans? Are you
I
seeing?
don't have a lot of that data just because I'm not doing them, right? I have an appeal specialist that does them. So I'd have to ask her, but I think that we get a ton from Humana, right?
Yeah,
That we get that they're more just kind of, technical denials or they're just denying for line items.
yeah,
We are getting some Part B stuff, ADRs from Medicare Advantage.
yeah, yeah. And as a compliance officer, is that, I mean, how do you safeguard against that, right?
You don't. What a terrible answer, right? You don't. No, I just think that you be prepared and know that you're going to have them, right? So, from a compliance standpoint and more of a quality assurance standpoint, it's are we doing everything we can technically? Just out the gates, right? Are we signing our documentation? Are we doing documentation on time? Is the physician signing the documentation, right? What do we have technically that we can do? Are our diagnosis codes appropriate? The little things. And then from there, it's more that quality assurance piece of does your documentation meet quality, right? Are you documenting that someone has weakness, but then putting within functional limits for the strength? Well, that's not going to fly, right? So we're trying to get a lot of that education out because we know that we know they're going to happen. We know they're going to ask for documentation. We know that they're going to review it. So how can we make sure that we are giving quality documentation so when it does happen, we can kind of pass those with flying colors?
And what is your organization doing in terms of auditing that quality documentation? How are you guys going about doing that?
Reading a lot of notes. We do a lot of education with the our directors of rehab and what to look for and to look at when it comes to documentation, but also kind of asking for some accountability from our assistants, right? If you're an assistant, you should be reading that evaluation, and it's okay to say, "Hey, I need a little bit more here," or we're missing something. Our assistants in the field are so highly skilled and so wonderful, and know exactly how to treat a patient. So we're asking them too to make sure when they read that document that they're questioning and going back to their therapist to say, "Hey, read your eval. Here's my questions about it," so we can kind of help in the field make sure that everything is as dialed in as possible.
Yeah, that's great. And how how many, charts or documents do you think you guys are auditing? I mean, you don't have to give me a specific number, but like you're certainly not auditing every chart, right? You
Oh, that'd
can't.
be impossible, right?
Yeah,
Just
yeah,
for
yeah, yeah,
from human eyes, right?
yeah,
Using
yeah,
technology is different, but like
yeah.
using human eyes to audit that.
Mhm.
Oh gosh, I don't even know. That's a hard question to ask.
Yeah. That's okay. That's all right. But
Yeah,
I
yeah,
mean,
I think
just
that there's tools and reports that we can use to
yeah,
like briefly scan through documents, so we're not
yeah.
reading full documents all the time,
Right.
but maybe we're
Mhm.
reading just goals, or maybe we're
Yeah.
just reading daily notes, that kind of
Mhm.
thing. So it just depends on, what our focus is that day or that week.
Yeah. Are you noticing that on the denials piece of it, that the insurance companies, Medicare Advantage plans and such, are they using more AI to scan through the
Yeah.
clinical documentation?
I've read a lot about it, but I also think that
Okay.
they are using it, right? So I do
Mhm.
think that sometimes they're just kicking a claim back because they think that they can, and then we're getting paid when we fight it. But I think that they are using AI, and that
Mhm.
just leads to my thing that we should use AI, right? If they're
That's right.
using AI, we should use AI. But that's
Mhm.
a whole nother can of worms, right? When it comes to HIPAA and security and regulations and all the things that come with that.
Yeah. Well, and it's something I do want to kind of just let everybody know here. An article that I was reading that a colleague of mine sent me. His name is Eugene. Thanks, Eugene, for sending this. If you're listening, but he sent me an article that about the Medicare Advantage Risk Adjustment Data Validation Program, or the RADVP program, that just rolled out, by the way, right? And what Medicare CMS is trying to do, they're trying to audit the Medicare Advantage plans, right? So in essence, they're using a lot of technology, such as AI, which comes in many forms, right? To review the medical documentation that the Medicare Advantage plans is submitted to them, right? Because they're trying to recoup some money, and it's in the billions, and they have a number, right? And
Yes.
they're going back to like 2016, but the technology now is allowing them to be able to review the documentation at scale, right? So
Yeah.
it's really interesting that CMS is going to start using technology a lot more to be able to audit the Medicare
Mm.
Advantage plans documentation, right?
Yeah.
And certainly that's going to have a trickle down effect on the provider as well, right?
Right.
So I
Because
would
if
expect to see
Medicare,
more. Yeah,
yeah,
exactly. So
if Medicare
Medicare,
Advantage has to pay it back, they're going to come to us because they're going to come clawing back to us to
correct.
get that paid for.
That's right.
Mm.
So I think that, auditing, it's going to become a very important thing in our industry, right? It is already.
Yes.
It's not that it's going to become, but it's just gonna, it's gonna play a higher role, I think, in making sure that from a compliance standpoint, that, we have all of our ducks in a row so that we're not getting, more denials because the Medicare Advantage plans are under scrutiny as well,
Mhm.
right?
Well,
Yeah.
and AI doesn't sleep. AI doesn't need a lunch break.
Right.
AI doesn't require a vacation, right? So it can just do a lot more faster, right? Um, but
That's
I
right.
think that it's going to be interesting to see, like, how do you combat that? What are they looking for? And if they're going all the way back to 2016, that's even more petrifying because we all know that things change, right? Last year you
Yeah.
could use this code, the year before you couldn't use that code, right? So sometimes we have to give them reminders of like, hey, you updated that, or you allowed that code at that point in time. So
That's
it's
right. And I want to say
scary
it's
to think.
26. It is. I want to say it's 2016 or 2018. I don't want to mislead anybody, but I mean you could read it on the CMS.gov. It's the Medicare Advantage Risk Adjustment Data Validation Program. Uh, it also, of course, it's got an acronym, right? So the acronym I'm reading here is CMS, the RADV expansion plan, which basically, it's infusing technology into, the audit review for Medicare Advantage plans. So it's I think, this is really interesting. I think that things are going to change, very, very rapidly in terms of your world in compliance and, you
Yeah,
know,
and I love technology. I just,
yeah,
we have to be on the same page, right? If they can use technology, we have to be able to use technology. And are they
absolutely.
following the same rules that they're going to ask us to follow, right?
Yeah.
Like I said, is it HIPAA certified? What are they running their documents through? And
Mhm.
like,
Mhm.
I feel like it needs to be very clear, right? Because we want to be on this, we want a level playing field.
Yeah, totally agree. Totally agree. I do want to start kind of changing gears a little bit here.
Yeah.
Well, I think that we're in a similar thread, but I think compliance and advocacy go hand in hand.
Mm-hmm.
So if we're talking about, making sure that we get every dollar that we can get out of the services that we're providing, right? And we're doing everything we can from a compliance standpoint to make sure that we're not getting claims denied and so forth. I think advocacy also plays a big role in that, right?
Yes.
So I know that you're super involved with advocacy, especially with NARA, right? The National Association of Rehab Agencies. Tell me a little bit more about, how do you get involved yourself in advocacy? What are some of the things that you're doing and some of the things that you're advocating for this year? And the most important things that you're advocating for. Let's start with that.
Sure. My philosophy is if you're going to complain about it, you should do something about it, right? We
I
can't
like
just
it.
sit there and complain and not do something. So I've loved that about, NARA and Avion and all of our organizations, right? They always promote advocacy, right? They want us to be better advocates for our profession and for all the great things that we do. So to me, once I got that first taste of like going to a senator's office or going to a representative's office and just getting to talk about what we do every day, I was like, oh, this is my jam, right? I could talk all day about how you need to make sure you realize how important PTOT and speech therapy is in the world, right? Someday, everybody in this office will benefit from a therapist. So let's talk about what you're doing to therapy. Let's talk about the physician fee schedule and how awful it is, right? Let's talk about how telehealth is needed and you guys forgot us. So those conversations are really enlightening to have. I always like to see the light bulbs go off whenever you're kind of talking to someone and you can talk about, do you know what PTs can do for pain relief and opioid addiction? And do you know what OTs can do for behaviors? And as a speech therapist, there's so many things that can happen with med management and the ability to swallow, right? This all these things that like are everyday tasks and to kind of see them be like, oh yeah, yeah, yeah. And then be like, so then why'd you forget us on this bill? And they're like, we did. So, it's very disheartening at times, but also like it makes you just realize how much we need to fight for our profession and what we do, right? We've had a 40 some percent reduction in the last several years for outpatient services for under the physician fee schedule. And when we tell people that, when we talk to our representatives and we talk to our senators about that, they're like, you have? And I'm like, yes, yes, we have, right? So it's if we're not going to be the ones to talk about it, who is, it's going to continue to just kind of get swept through and swept by. And someone will get a 20% increase and then they'll take it from us so that they can, pay for that. So we have to be the voice. We have to get our therapists in the field to be the voice, right? They all want to get paid more. They all want to be recognized for what they do, but it's hard to pay therapists more whenever we keep getting haircuts in the reimbursement department. So I think it's important that we really rally our therapists to teach them you have a representative right down the street from you. Have them come to your building. Have them come to your clinic. Show them all the miracles that you work every single day so that when that bill comes across their desk that says, hey, we're going to give therapy a 3.7 reduction, they can be like, why would you do that to the therapist? Have you seen the miracles that they perform?
That's right. That's right. Yeah, that's so cool. I mean, I think that, and I'm part of Allion, and they do amazing work as well, in terms of advocacy. And um, it feels very empowering to be to have a voice, right, in that scene. And sometimes it's frustrating, right, because you go
Yes.
year after year to Washington, right, and meet with senators and congressmen, and things don't change, right, and that's frustrating. But then things do, right, like with telehealth,
Yes.
for example, and that's very encouraging, right? How do you? I love your idea. I mean, I love how passionate you are about having advocacy at the ground level with our therapists, right? Because we have hundreds of thousands of therapists, PTs, OTs,
Yes.
therapists, and that's very powerful when it comes to getting a voice in Washington, right? How do you? But that's not easy to pull off, right?
No.
As therapists are doing their job, and they treat
Yes.
patients, they want to go home at the end of the day, see their families, um, and go about their lives, right? How do you encourage a therapist to advocate, right? How do you motivate them to advocate, and how do you make it easy for them to advocate so that we can do this at scale?
Yes. Well, I think what you just said is key. How do you make it easy for them to do, right? And I think that's what I appreciate about the campaigns from NARA and the campaigns from ABTA and Avion and all those other organizations because sometimes it is just as easy as clicking a link. You get to click a link. You click the
Sure.
link. It takes you 30 seconds to put your email address in, your
100%.
home address, and then you can write a story in there if you want, or you don't even have to. You can just say, please support this because you're going to get some signatures behind it because they have to read that, right? They're going to read that stuff. So the easier the better. We try to send out all of those to all of our staff. We try to put that in,
Awesome.
our messenger or an email so that all staff can do that. It's 30 seconds. Um, Advocacy doesn't have to be hard. And I think that's the thing that we need to kind of get out of everyone's brain. They're like, oh, nope, you have to go to Washington, D.C. It's the only way to be an advocate. You have to march down the street. No, that's not what advocacy is about, right? Advocacy is about when your patient leaves, you say to them,
Mhm.
I'm so glad you're going to be able to go to church next week. I'm so glad you're able to do that because therapy made a difference. Because
Yeah.
then that person goes to church and they tell three of their church friends, therapy made a difference for me, right? Therapy
Mhm.
improved my life. And those three people remember that story, and they might have a neighbor who knows somebody who knows somebody. And it just kind of spreads the word. Like we can market that way. That's being an advocate for yourself. That's being an advocate for therapy. Doing the emails, super easy to do. Finding your local representative. If you vote, you know who they are. You are their constituent. Their job is actually to work for you because you voted them in. Write them a letter, send them an email. You can sign up on their website to just subscribe to their, weekly updates and then you could email them back and say, hey, don't forget about therapy. Would love for you to come to our building, if your building approves of that. Or would love to come to your office to talk to you about what's happening in the industry. So you can do something super, super simple, like just advocating to your patients or saying to your patients, this is the insurance that you chose, you can fight for better care. You can fight for better insurance. To doing that email, to going to your local representative's office, or big scale, going to Washington, D.C.
Yeah. Oh, I love that. I love that. If there's anything that we got out of today, there's been a lot of good gems, but I love this one in particular because I think that if every therapy organization in the country thinks this way, right, and especially at a management leadership level, right, and really gets the buy-in from from our therapists, right, to advocate, and volume matters, right, in advocacy.
Yes.
It really
Yes.
does. And if if you can learn from Keely, you know, please do and reach out if you're okay, so
Yeah,
that you can
absolutely. You
maybe
just
give
got
some
to ask.
pointers, get some
Well,
pointers, so that we can get more organizations to help their therapists advocate as well. I think that's great.
my favorite unfavorite story is that the hospitals had interoperability paid for because they asked. That was the answer. We just
Sure.
didn't ask. So sometimes it's okay that we just
Mhm.
ask because you never
That's right.
know what
Yeah,
will come of
that's
it
right.
whenever you ask.
Yeah.
And that's a way to be an advocate for your profession.
Well, I love it, Keely. I think this is a great way to end here.
Yeah.
Where can people find you? Are you hiring for continuing therapy?
We're always hiring therapists. We're in 13 different states. So look at Continuum Therapy Partners. We'd love to have you. We love ambitious therapists who want to do great quality care. So um, we're all over, but we're
Great.
just happy to be here with you, Luis. We appreciate you and all you guys do.
Course. Yeah. Well, Keely, thank you so much for taking the time.
Yeah.
This was an enlightening conversation for me. I think I've learned a lot about compliance and advocacy, and hopefully, everybody else did as well. So reach out to Keely. Thanks
Yeah.
again, and we will see you on our next episode of Innova Chats with another one of our guests. Thank you, Keely, again, and see you until the next time.
Thank you. See you later.
Bye, Keely.
Bye.